Welcome, everyone, to a brand new high-stakes explainer. Today, we're breaking down a true zero margin for error medical protocol. We're looking at the exact step-by-step procedures of oxygen administration. Now, you might think, hey, it's just handing someone a mask, right? But for emergency medical professionals, no way. This is a highly regulated, tightly sequenced operation. Doing things out of order isn't just a tiny mistake, it's an absolute failure. So let's just dive right into this with a question that might actually surprise you. We all know oxygen keeps us alive, right? I mean, we literally can't survive without it. But did you know that the very element keeping us breathing can actually be a deadly threat to a patient if it's not administered correctly? It's completely true, and it fundamentally changes how medics have to approach this treatment. Take something called the hypoxic drive. For most of us, our brain triggers a breath because carbon dioxide is building up in our blood. It's like a built-in alarm system. But patients with severe COPD, they're wired a bit differently. They actually rely on low oxygen levels to stimulate their breathing. So, if a medic suddenly blasts them with pure oxygen, their brain basically says, oh hey, we've got plenty, no need to breathe, which can potentially cause respiratory arrest. Plus, delivering more than 50% oxygen over a few days can literally lead to oxygen toxicity. So yeah, it's an incredibly powerful drug that demands major respect. Okay, so our roadmap for this explainer is pretty straightforward. We're covering why oxygen matters, the strict safety rules, the pre-flight check, choosing the right mask, and finally, the medic's rapid checklist. Let's get right into it. First up, why oxygen matters and how we combat hypoxia. Basically, the entire purpose of this protocol boils down to one absolutely critical state: hypoxia. This is a severe deficiency of oxygen actually reaching the body's tissues. Whether someone is dealing with trauma, shock, or a cardiac emergency, their body's demand for oxygen has just massively spiked. So even though oxygen carries risks, as we just talked about, there are absolutely zero contraindications if a patient is actively hypoxic. We're talking about a literal ticking clock to preserve their organ function. Moving on to the strict safety rules for handling these cylinders safely. Before this equipment even gets close to a patient, we really have to look at the rules of engagement. These cylinders, they have to be secured at all times. Think about it. If a valve snaps off, that super heavy, highly pressurized tank essentially becomes a torpedo. And here is an absolutely crucial rule. You cannot, under any circumstances, use tape or petroleum-based products anywhere near this equipment. Mixing pure oxygen with the hydrocarbons in something as simple as lip balm, that creates a massive immediate fire hazard. No smoking, no open flames, and keep those valves closed when you aren't using them. Because the stakes are just that high, the very first thing a medic must confidently declare out loud is, I am taking standard precautions and applying BSI. That's body substance isolation. Saying it out loud really locks in the seriousness of the situation. Gloves and PPE go on immediately. You have to ensure protection from bodily fluids right out of the gate. All right, next up is what we call the pre-flight check. This is all about inspection and setup. I want you to think of this phase exactly like an airline pilot's strict pre-flight inspection checklist. It has to be done in this exact order. After your BSI, you inspect the equipment. You're looking for unbent regulator pins, making sure there's an intact O-ring, and checking for a current hydrostatic test date. That date literally proves the tank is structurally safe to pressurize. Then you crack the cylinder, attach the regulator, check for leaks, and check the tank pressure. Skipping even one of these checks, it completely jeopardizes the safety of the entire mission. Let's zoom in on step 3 for a second, because it's a really fascinating mechanical necessity. It's called cracking the cylinder. You basically open the valve just a tiny, tiny bit and then shut it immediately. Now, why do we do this? Well, it's not just to hear that cool hissing sound. It actually blasts out any dust or microscopic debris sitting in the valve opening. You absolutely do not want to blow dirt through the regulator and straight into your compromised patient's lungs, right? Okay, so once that regulator is securely attached and you've opened the valve fully, you check the pressure gauge. You're looking for about 2,000 to 2,200 psi. That number tells you, yep, you have a full cylinder. To put that into perspective, at 2,000 psi, this gas really, really wants to escape. That is exactly why, as you attach the regulator, you have to actively listen and feel for any leaks around those connection points. This brings us to choosing the right mask and proper device application. So, we've got a safe,
pressurized cylinder ready to go. Now, medics have to escalate to actual patient application. And as you'll see, they have a surprisingly diverse arsenal of delivery devices at their disposal, ranging from a simple nasal cannula all the way up to a non-rebreather mask, along with very specific liter per minute flow rates. The medic's job is almost like a puzzle. They have to perfectly match the specific delivery device and dial setting to the patient's exact physiological needs.
Let's actually break down these numbers, because they matter a lot. Patient in mild distress. You go with a nasal cannula, set between 1 to 6 liters per minute. That maxes out around 44% oxygen delivery. But what if the distress is moderate to severe? Well, then you have to escalate. You grab the non-rebreather mask, crank the flow up to 10 to 15 liters per minute, and boom, you're delivering up to 90% oxygen. And if the patient is apneic, meaning they are not breathing on their own at all, you move immediately to the bag valve mask. You flow that at 15 to 25 liters per minute to push nearly 100% pure oxygen into their lungs. When a medic is standing over a patient in total respiratory failure, maybe during a high-stakes graded scenario, this is the definitive action. They have to state loud and clear, I am applying a bag valve mask at 15 to 25 liters per minute, delivering 97 to 100% oxygen. It leaves absolutely no ambiguity. They are taking complete control of that patient's ventilation with the maximum possible oxygen delivery. Finally, let's look at the medic's checklist and how they use rapid memorization. So, you might be wondering, how on earth does a medic perfectly memorize this complex setup under intense pressure? Well, they use a highly structured rapid-fire mental timeline. Step 1, BSI. Step 2, inspect. Step 3, crack the tank. Step 4, attach the regulator. Step 5, open it fully. Step 6, check for leaks. It is a strict, unbending, sequential mandate. And all of that translates into this ultimate rhythm-based memorization chant. Medics literally drill this into their heads over and over. BSI, inspect, crack, attach, open, check, cannulas up. Following this punchy mnemonic ensures that in the absolute heat of the moment, when alarms are blaring everywhere and adrenaline is pumping through their veins, not a single life-saving or safety-critical step gets missed. Once that whole system is checked, it's time to escalate through the cannulas and masks as needed. It really makes you think, doesn't it? I mean, we breathe oxygen in and out all day, every day, without a second thought. But the very second it becomes a medical intervention, it suddenly requires profound precision, strict mechanical safety, and this exact physiological understanding just to prevent harm. If a seemingly simple, invisible element like oxygen demands this level of mastery to save a life, what other invisible systems keeping us alive are we completely taking for granted? Definitely something to think about. Thank you so much for joining me for this explainer. Stay curious out there, and I'll catch you on the next one.